So I'm going to demonstrate how to administer oral glucose to a neonate. The first thing you want to do is gather all your necessary materials, which will include clean gloves, a medicine cup, some sterile 2x2s, an oral syringe, and your Glutose 15 dextrose gel. Next, you'll want to verify the order in Epic, which will give you the amount that you will need to administer to the infant. With clean gloves, you'll begin by removing the cap on the medicine, twisting the top off the gel tube, and squeezing approximately 5 ml of gel into the measuring cup. Start with a generous amount of glucose that we've squeezed into our medicine cup. I verified my order. My order is to give 2 ml of oral glucose. So what I'm going to do is I'm going to draw approximately 2.5 ml into the oral syringe. I'm going to draw back the medicine and kind of swirl the syringe in the cup to avoid getting air bubbles into our syringe. If you find that you get an air bubble in the syringe, you can always expel the medicine back into the medicine cup and start again. Now I've drawn up approximately 2.5. My order calls for 2.0. So I'm going to squeeze the extra medication back into the cup. And now we have 2 ml. All right. So after you've drawn up your medication, you'll want to verify again in Epic by scanning your baby and then scanning the barcode on the medication. So the next step in the process is to administer the medication. I've changed my gloves, so I have clean gloves. And then what we need to do next is swab the mucous membranes, dry out the baby's mouth. We'll use sterile gauze. We'll simply dry the baby's mucous membranes with the gauze. So now it's time to administer the gel. You're going to administer the gel in quarter doses. So you'll apply approximately a quarter of the gel onto a clean gloved finger. So when you go to administer the gel, you want to apply it to the inside the baby's gum and on the side of the cheek, and simply massage it into the baby's membranes. I'll apply another quarter dose to a gloved finger and apply it to the other side of the baby's mouth. So I'll continue to administer the medication in quarter doses until the entire dose is given to the baby, alternating sides with each application. So after I've administered my initial dose of the dextrose gel, I'm going to encourage the mom to refeed the baby, and then we're going to check up blood glucose in 1 hour after the dextrose gel has been given. If the baby requires a second dose, an order by the MD would be required for any subsequent doses of dextrose gel. So the Glutose 15 dextrose gel is good for 24 hours after the initial dose. I'm going to place this in a blue medication bag, and I'm going to label the bag with the baby's name and date and time that the initial dose was given.
It can be kept at room temperature and can be used for a max of 3 times for each infant. The second and third doses would need to be given by a direct order from the physician.